Hello, I'm Richard Hara, and this is Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. I'm pleased to have here on the program today Dr. Louisa Gilbert. Dr. Gilbert is a licensed social worker with over 25 years of experience developing, implementing, evaluating, and disseminating multi-level interventions to address gender-based violence, HIV/AIDS, substance misuse, opioid overdose, and trauma among key affected communities. She has served as the co-director of the Social Intervention Group at the Columbia School of Social Work since 1999 and is a co-founder and co-director of the Global Health Research Center of Central Asia since 2007. Dr. Gilbert holds a BA from Barnard College and an MS, MPhil, and PhD from the Columbia School of Social Work. Dr. Gilbert is here today to talk about an intervention developed for gender-based violence called WINGS and how it's being tested internationally for women who are sex workers, migrants, or internally displaced. WINGS, which stands for Women Initiating New Goals of Safety, is an evidence-based screening, brief intervention, and referral to treatment service tool that was originally designed to identify intimate partner and gender-based violence among women who use drugs in New York City. The intervention enables participating women to develop safety planning strategies and strengthen their social support networks. It's now been implemented in 6 countries and is available in 8 languages. Dr. Gilbert, welcome to Social Impact Live.
Thank you, Richard, and it's really an honor to be here and be with you.
Well, it's such a pleasure to have you here to talk about your work, but also if we could hear a little bit about how you got into social work and maybe into this kind of, or this area of research. Yeah, briefly.
Yeah, briefly, I got into social work as I was doing work with women in India and trying to develop sort of income generating programs for women in India, and then I came back here to the States and wanted to do the same for women here, and I ultimately ended up focusing on women who use drugs and looking at issues of violence against women.
Oh, okay. Yeah. All right. So
when I was in social work practice before I sort of shifted over to research.
I see. Okay, so you're in the practice and then went to get your PhD, I imagine?
Yeah.
To focus on women who use drugs and interventions to help with gender-based violence. And before we talk about programming, I mean, if we could zoom back a little bit and, you know, when we're talking about gender-based violence or
what do we mean?
Intimate part, I mean, what are the things that we're focusing on?
I mean, the UN definition of gender-based violence is really patterns of physical, sexual, economic abuse, psychological abuse that are related to perceived gender role norms and ultimately based in unequal power relationships that are driven by sexism and heterosexism and intersect with racism and classism and all the other isms. Yeah. So and sort of my focus in gender-based violence has been on women as survivors. That's not to say that men can't also be survivors and women can't be perpetrators, but I just wanted to kind of
that was an interesting piece, I think, in some of the readings that I had in preparation, that it's the experience, but it's also the perpetration of gender-based violence that you're looking at and hopefully intervening with here, right? In your work. So you're working with women who use drugs initially, and do they have special needs, or what was the tie-in?
So I just want to give a shout out to my group at the Social Intervention Group and Dr. Nabil Al-Bassel, who I've worked with for 30 years on
Okay.
this
Yeah.
on this work together, because it's collaborative work. Dr. John Goddard Eckrich and a whole group of people this represents the work of. But we got started 30 years ago with women in methadone treatment. And at the time, I was also serving on a board of Sanctuary for Families, which is a domestic violence organization. So I was seeing, you know, a lot of the women. We were doing HIV and relapse prevention interventions with women in methadone maintenance treatment. And the sort of level of partner violence and violence from everybody in the community, including police, kept on coming up again and again as a real barrier to women engaging in treatment and engaging in HIV prevention. So we felt that drug treatment programs really needed better tools to address the intimate partner violence issues and violence in general from other people in their community. And the same thing, as I was on sort of the board of Sanctuary for Families, it came up again that a lot of the women coming through who, you know, and who were serviced were using drugs and alcohol to cope with the violence. And so there was somewhat of an issue policy of don't ask, don't tell, because we really can't address the substance abuse on our premises, because that would mean a lot of women who are at least in residential facilities wouldn't be able to stay.
Oh, yeah.
So we saw a real gap in services for women who use drug, from both the drug treatment side and then also from the DV service side.
I see. You think about substance misuse and treatments and sort of a medical model and not sort of seeing it in a social context. And then, you know, how does one affect the other, and particularly in terms of intervention programs. So this was the base, right?
That was the base.
Okay.
And so when we started looking at the research, what we discovered is women who use drugs have rates of intimate partner violence that are 3 to 5 times higher than women in the community. And they experience much more severe violence and violence from non-intimate partners. And so we designed and developed a tool called WINGS that was designed as just a screening, brief intervention, and referral service tools to identify intimate partner violence among women who use drugs. We got funding from the National Institute on Drug Abuse to evaluate this tool in a randomized clinical trial where we recruited 190 women who use drugs from actually community correction sites across New York City. And half got randomized to receive the WINGS intervention in a completely self-paced computerized tool, and half received the intervention delivered by a facilitator. And what we found is that both the computerized tool and the face-to-face intervention were equally effective in identifying really high rates of physical and sexual violence in this group. It was, I think, 47%. And each condition experienced either physical or sexual violence in the past year by their intimate partner. And both tools were equally effective in linking women to treatment and services for intimate partner violence, as well as expanding their social network. And then we later sort of tested the tool in another randomized controlled trial with an HIV prevention intervention. And in that trial, we discovered that the tool was effective in actually reducing incidents of intimate partner violence compared to a wellness promotion control group.
Wow. So those are sort of very real-world substantive outcomes as well. Yeah.
So the whole idea is, where can we go and find all those women who are not reaching the services, who are using drugs, experiencing severe violence, and link them to services in the community?
Okay. Well, it's a tremendous model, evidence-based, right? And as I said in your introduction, something that you're disseminating, with different populations and so on. And before we move on to that piece, I just want to remind our viewers that we do have a Q&A period at the sort of 20-minute mark of the program for the last 10 minutes. So if you've got,
please shut me up. I could talk forever about this.
If you've got some questions, please jot them down, submit them via Facebook, and Dr. Gilbert will be addressing them. So just that reminder. Okay, so dissemination. Now, in the introduction, I mentioned that this WINGS model has been applied in different countries,
Right.
Has been translated into
a
a
lot
number of
through
languages.
my former students, I
Yeah.
have to say. I mean, and that's been just a tremendous thrill for me to work with our students who've taken it. I think if we give Kyrgyzstan as an example, which probably is the longest standing project of WINGS that has been going on continuously since 2013.
Wow.
So Daniel Nicholton, who was a former student, I was a mentor to him in 2006. He graduated from the program here. He had this idea: is we need your intervention over there now.
Wow.
Violence is a huge issue. We don't know what the scope of it is. And so he recruited like 5 different harm reduction programs over there. We received funding from the Open Society Foundation, and we expanded the tool and adapted it in several different ways. We went beyond just screening for intimate partner violence, but also gender-based violence, and discovered extremely high rates of both intimate partner violence and gender-based violence, including 50% of the women reported experiencing police violence.
Wow.
So what do you do when you're experiencing intimate partner violence, and who do you call, right?
Yeah.
You call the police. What if you don't have
What
that
if you-
protection? So during that party, Daniel pulled together all these key stakeholders in the community, including people, the police, the medical providers, emergency response providers, women who use drugs themselves as consumers, and brought them all together to look at how can we come up with a coordinated response to this really serious issue.
That's tremendous.
And sort of started building scaffolding this community level intervention, which we've just gotten, or he's just gotten funding from UNDP to sort of use WINGS with the community level intervention called Sunflower, which is really like opening up the doors of all the services in the community, whether it's social services or family and children's services, to be able to screen for intimate partner violence using WINGS. And he's spread it now to pretty much throughout Kyrgyzstan with the help of his collaborators at UNDP. So.
Yeah. Well, speaking of
Yes.
Daniel,
Yeah,
I
please,
think
let's show
we've
Daniel.
got a video that we can show, if we can cue that and run that.
I was very surprised how interesting it was to adapt to integrate these two models, WINGS and Sunflower. They are really adaptable, so it's really a solution from which many women will benefit, and we will just have to be creative in how to further adapt them and develop so that they become more beneficiary to our clients. Thank you.
Wonderful. Having a video like this, I think, is just testimony to how connected, your programming is to local communities and how they articulate their needs. Your thoughts about that?
Well, I mean, every country has been different, and the needs of each country have been different. So in Ukraine, I'm working with a master's student in public health who I was assigned to as a field instructor. And she really wanted to take it towards internally displaced women in Ukraine because of all the conflict there. And there's just high rates of all different types of gender-based violence and intimate partner violence combined. So they adapted the tool for women over there, and it's now in 4 different regions, and she got funding from UN Women to do it. In India, they've also adapted it to not only women who use drugs, but women who engage in sex work, HIV positive women, trans women who are at risk, and it's been scaled up in 4 different cities. They've also decided, because there weren't that many services in a lot of these towns, and they haven't quite gone the community level intervention route, is they built a support group for women who went through WINGS to kind of encourage each other to, work on their safety plans, provide each other, if they needed a safe place to stay at night, what they could do with their informal social network.
Right. So let me see if I can understand this. So the tool that you're talking about, this is a sort of one-day workshop? I mean, is it something that takes place in, I mean, where does it happen?
Where does it happen? Okay. Well, if you look at projectwings.org, it has the actual, there is a computerized link to the computerized tool there that you can access. And so that tool takes about 45 minutes to an hour to go through, depending on how you answer the questions.
Okay.
And it walks you through a psychoeducation piece to raise awareness of the different types of violence. Then it walks you through a standardized screening on, the violence and gives you feedback on it. It does a brief kind of motivational interviewing piece to raise awareness and what types of safety issues are coming up for you and what your motivation for keeping safe. And we keep a harm reduction approach because a lot of women want to stay with their partners. And so the idea is, how do we keep them safe and stay with their partners? And then it does a safety planning and identifying service needs and linkage to services. So that piece takes like an hour. Some of the Wings has been adapted to do follow-up meetings and interventions to see if people were able to link to services to help with that. It's been integrated into HIV counseling and testing, so that, if you do HIV testing and you're in a violent relationship, how do you disclose to a partner? Whether you disclose to a partner, how does that all happen? And then we've also integrated Wings into overdose prevention activities for women who are using or injecting heroin and other opioids.
Okay, so this is a kind of module that could be added to other services being provided?
Yeah, so we've integrated into our HIV prevention interventions. We've integrated into our overdose prevention activities, so it can be integrated or it can be a standalone. But I think the biggest lesson learned for us is it's also empowering communities of women who use drugs to be able to collect data to document the different types of violence and gender-based violence that are going on in their communities and sort of raise awareness at a community level. We need to do something about this. And so the idea is to have a more data-driven response that the women who use drugs as consumers are leading. And that's what was, I think, really unique about the Kyrgyzstan model and what's also going on in India as well, is to really empower women as consumers to be able to document
it occurs to me that you're sort of working with women who are, for whatever reason, in sort of stigmatized positions in the society.
Very much
who
so.
Can get, but so I guess my big question, particularly when you're working in other countries, is, I mean, the cultural piece and so on, and the adaptation and different attitudes about gender relations and so on. Is that an issue that comes up
all the
a
time?
lot? Yeah, and how do you manage it?
Well, all the time, and I think a lot of it is breaking down the stigma, because a lot of women who use drugs internalize that stigma. I mean, they feel like they're bad mothers, they've been told everything else, and to disclose the violence, they don't even see it as violence sometimes. So that brief psychoeducation piece of breaking down the internalized stigma is really important. But at a community level, it's so important, because if you have police perpetrating violence against these women or other emergency responders calling the husbands up, when they come for emergency help, there's real problems and issues. So a lot of it is really breaking down the stigma, both at a provider level and an internalized,
Yeah, and that's how you, as a sort of academic partner, but also working with agencies and organizations like UNDP, can sort of serve as that, springboard for having these community-wide conversations.
Right. That is so. I mean, in communities in Kyrgyzstan and even here in New York, we had community advisory boards to really start, once we use the tool to really generate data and looking at what's the prevalence and incidence of different types of violence that these women are experiencing, is to take that data and run with it and say, this is when we first, in Kyrgyzstan, for example, generated the data on police violence against women who use drugs. We brought together the Deputy Minister of Interior, the police, and we were really nervous. We presented back that data, and they were like stone silence. And then finally the Deputy Minister got up and said, I want to know when, where, how this is happening. Let's collect more data. And so there was a responsiveness, and as a result, we also said, let's do a police training on gender-based violence, which we were able to get funding to do. Let's set up women-friendly units in the police department to be able to respond to it. So those are the kinds of ultimately going upstream and trying to tackle
Yeah.
the issues.
Well,
That I think.
that's tremendous, because so often when we think about direct practice, we're thinking about, well, we'll use these evidence-based interventions, but you're also collecting data, and you can't change policy unless you've got the
Right.
data.
Right.
So you're
There was a
working.
lot of anecdotal data before that this was happening, but the numbers really kind of helped sort of catapult, and catalyze change. I think system level change.
Wonderful. I know we've got some questions, so if that's okay, I can turn to them now. I'm interested in hearing more about how the WINGS program challenges male partners to reflect on and change their behavior. Are they included in the model?
No, they're not, and that's a fabulous question. It's ultimately we do have to get to the perpetrators if they're male partners who are doing that, or if it's mutual, to figure out how to do that. The way we've really tackled that piece is to bump it up to have that sort of community level response to it, and then also hopefully to identify those male partners and have the system work with them.
Right.
But ultimately, we're not going to make to really make it an impact on this gender-based violence issue. It's about getting to the men as well, and it's a very important question.
Yeah, absolutely. This conversation and work revolves significantly around the gender binary. What work is being done that includes GBV for individuals that do not identify as a woman?
As a woman. Great question. I actually am working with a recent graduate from our program, Mark Minio, to adapt WINGS for transgender women and LGBTQ communities. So it's a great question. India has also adapted it to for trans women, and I actually have another former student, Sabine Ahmed, who graduated maybe 6 years, who's interested in, she just got some money to adapt it for trans women in Pakistan.
Yeah.
So,
Can WINGS address community resistance to prioritizing intimate partner violence survivors?
I think the example of Kyrgyzstan, it did.
It did, yeah.
Yeah, it really did, because I think it wasn't on their radar screen at all. It wasn't in the police radar screen, and it was there was no safety planning done in even the domestic violence agencies.
Yeah.
So they were able to sort of raise all these issues up to a community level and structural level. Yeah.
And again, it's important to note that when you implement a program like WINGS in a different country, that you are working with a whole range of stakeholders, right?
Yeah.
And you can leverage that in terms of sort of creating both conversation and action, right, to address some of these issues.
Right.
All right. Well, let's see. Oh, more questions. Hi, Dr. Gilbert. I'm a prospective student for the MSW at CSSW, and I was wondering if the program has been implemented in any West Indian communities. Also, how do you handle pushback to the program? So, what is the range in terms of the different countries where it's been implemented?
Okay, so it's been in Kyrgyzstan, India, obviously the U.S. Now it's going to Pakistan, but also in Ukraine and Georgia. So, and Indonesia, actually, here it's there too. I recently heard from a colleague that someone had taken it over there, and I don't even know. So I'm not even sure where it is. But West Indian, I'm delighted to tell you that my close partner and colleague throughout this, Dr. Don Goddard-Eckrich, who's from Trinidad, has real plans to take it to Caribbean. We are actively looking for proposals and RFAs and PAs to respond to on that.
And the second part of the question regarding pushback. I mean, how have you? I mean, I do. Yeah. Is it always an easy sell, or no?
I mean, it is where there's just no resources to deal with it. I mean, it's been a huge issue and need, and people largely have been very responsive to it. I do think we've gotten pushback from the police on it. In some ways, they, the defensiveness about, when we ask them like how are, to have a better response to it. We've gotten some pushback there. but not, for most part, it's been really welcomed in communities, and people see it as serving a huge need. So, yeah.
And are there communities where, I mean, what's the longest track record for this program? I'm thinking in terms of, follow-up and longer-term implications.
Well, I would say, I mean, Kyrgyzstan has been continuously implementing it since 2013. And they've not only scaled up in the number of geographic region that they're covering, but also they've expanded it beyond women who use drugs to women who engage in sex work and to general populations of women at risk, rural women, where there are very few resources.
Okay.
And so they've scaled it up throughout the whole country with this latest UNDP grant.
And given all the different populations and settings where this tool has been implemented, I'm curious, what have you learned from that history, from that track record that has gone back into the program? I imagine, it's a continuous evolution,
cool.
right?
Yeah, no, it's iterative. And
iterative.
I think, in the sense of the adaptations that like Kyrgyzstan made and India made to it, now Ukraine is taking that. So they decided we need to have this community advisory group so that we, once we can make that system level change to have more responsive services. We need to have that group, option, because there are not a lot of places where women who are actively experiencing violence have that space to get together. They're not, especially for women who use drugs, they're usually excluded from most domestic violence services or don't feel comfortable coming into them. So they've taken those adaptations. And are still using the computerized tool. Daniel's now adapted and turned into an app so that we can get out to a greater population of women at risk who may not feel comfortable coming into services at all.
Yeah.
So, yeah.
Okay. Well, thank you. Another question. Thank you for sharing all your work, Dr. Gilbert. I would like to hear a bit about your work in India. I have studied abroad in India, and I am currently working on a research project regarding dowry-related violence in India. Oh, yeah. Do you happen to know what initiatives are being taken to halt dowry violence in India? Thank you once more for all your knowledge.
Thank you for this question. And I think it just goes to show the tremendous variation in how gender-based violence evolves and plays out. Like dowry violence is a huge issue in India. It's not over here.
Right.
Threats of burning women are that's standard in India and Kyrgyzstan. That's not an item that you would have on a scale over here, as on a standard scale here. So we are now implementing wings in 4 different areas in India, Pune, Delhi, Manipur, and in the Punjab. And we are actually hoping to get results from the evaluation soon. They just wrapped up their 6-month follow-up, so we will be better. They did an initial pilot in Pune where they saw a reduction in different types of violence over time, but wow. Looks like we have more questions.
Yeah, has WINGS been implemented with Latinx immigrant women living in the U.S.?
Okay, great question. I had a student, it was 2 years ago, and Adriana, she took WINGS and worked with a group uptown to translate and do a cultural translation of the whole tool. And we just have not gotten funding for it. So that one's on a back burner. We do have a Spanish translation. It probably does need a much deeper kind of cultural translation to it, depending on where it gets implemented. Particularly the issues with immigrants that's a whole issue of how violence evolves and plays out among immigrants and the threats of deportation and green card. I mean, it's a whole nother layer of abuse that goes on, both by the partner and by the system.
The system, I was going to say, itself.
It's both. So if anybody's interested, please reach out and contact me. I'm always happy to collaborate and try to move the work forward. And
if anything, what I get a sense of is how this work is just evolving and growing day to day with the involvement of students.
The students,
it's tremendous.
They were the ones who've taken it forward. We have terrific students, and I've been really honored to work with them.
So we've got a last question or comment that maybe you can respond to. I'd love to follow up about using WINGS with human trafficking populations.
Yeah, the 20 million women who are trafficked every year. That's a great question. We have added questions to get at whether
Right.
women are trafficked, especially I think Ukraine is now also adding those pieces because there's a lot of trafficking through that region. But we have it here in New York.
Well, yeah.
We do. And that's part of the gender-based violence that we are trying to track. I think there's one. Is there another one?
No, I think that's that's it. So, so we'll sort of be looking for that in future iterations
Yes.
of the
A really important
Wings
question
Project,
because that's
yeah.
a whole systemic issue of gender-based violence is human trafficking. With the that's huge.
Okay. Well, thank you so much for
Thank you so much. It's
coming
been
here
great
to
to
the
catch
program.
up with
Yeah,
you.
wonderful.
Yeah.
And wonderful work that you're doing. That concludes today's episode of Social Impact Live. Next week, we will be joined by Cameron Rasmussen and Cheryl Wilkins, two
that will be
organizers of Beyond the Bars. Yeah.
that'll be awesome.
An annual conference that grapples with strategies for challenging mass incarcerations. So thank you all for joining us today. Thank you to our guest, Dr. Gilbert.
Thank you, Richard.
And see you all next
thank you.
week.
Yeah, thanks.
Okay. Bye-bye.